Good. I speak fast. I'm exhausted. Okay, so now we're going to talk a little bit about setting up the office. If you're not having aesthetics practice that you're already used to seeing patients or doing the photo before and after photos, this may be just kind of really recapping what is needed. So you would need a consultation room, like everybody needs a front desk, right? So then you need a consultation room, you need a photo room. The more consistent you are with your photography, you may not have a separate room, you may have a corner. We put the dots on a wall and paint the back, and probably you already heard a lecture about the photography, but it's important, okay, so you'll hear it tomorrow, but it's important to be consistent. You need a storage room and you need a clean room to clean your instruments. Surgery room, there's a table, there's a stations, whether we do FU or FUT, we use microscope to sort our grafts. We do IV sedation, so this is a nursing station. We have a supply, and we have the back counter for the medication and other things. In our setting is, I sit here, I sliver, and then the ladies in the back all dissect, if we do FUT. And usually you would have 2 lights to illuminate your area. If you're starting the practice, there are different chairs. If you're doing FUT only, and now since most of you will be doing combination surgery, then you may want to look for a chair that can be transformed from sitting to a prone position. And the price vary depending on whether you have memory foam or not, whether it is wireless remote or not. So look through what is available, go to our vendors upstairs, talk to them. They have been with us in the industry for so many years. They are very honest, and they are there to serve you for a long time. So they will be frank with them, ask them what you need, and they will be more than helpful. They can even help you with the startup list of equipment that you need. Lights usually has to be a cool light. You don't want a light that is warming up not you and the tissue you're working on. Adjustable lights, then the tables, everybody has a little bit of different. I found these tables, there was IKEA had a table like this. You can fold it, you can add the microscope, you can transform your room. If you're not doing hair transplant all the time, you can transform your room into a surgery room and add microscopes if needed. This would be the length of the table, depth of the table that you need for comfortable to put the microscope and have enough supply that you can use during the procedure. Microscopes, you need a sterile microscope. Look for the platform that is not too high. Sometimes it's easier to lean your hands with the platform that is either slanted, or sometimes they would have a support on the side so the assistants can rest the hands. There's a Mantis microscope, uses mirror reflection. It doesn't have fine tuning. There's a static lens, and then you can just use that lens. This one can have a different magnification. Try both and see what works better for you. Stools, you want to make sure that the stool goes high and very low. The small range is not good, because you will be sometimes placing would require one person to go very low, work from the crown. Sometimes you will have to go very high to reach the crown. So depending how you work, it's always more advisable to have a stool that has a high range of adjustment. You need magnification. Everybody needs some type of magnification. The more magnification you use, the better you see, the more comfortable you feel. However, you have to keep in mind that the higher magnification, the smaller the field. So you have to develop a habit to step aside and look at the field, because sometimes we can be caught up in a work and not see the big picture. Instruments, whether you use different tools to FUE dissection, there's a robot, and then there's a different instruments for harvesting, extracting, placing. Once again, we can make a round upstairs with the vendors and the specialized instruments. I can go and share with you what we like and why, and help you kind of make a judgment what you think would work better for you. We don't have any financial interest to promote our vendors, but they have been working with us for so many years. They're really there to help you. Just kind of summary of how much it may cost you in average. Unless you are buying a robot, it may go even higher. But this is just the basic things, depending on the lower range and higher range, and then you have to add your machines and your other equipment that you may want. And the last thing is, so I mentioned this about vendors, but as colleagues, sometimes ask if you can visit someone's office, so it kind of gives you the visual idea of what the setup should look like. So that may be also an option. And the last slide here is about staffing. All the time we're asked, should we train our staff? Should we hire experienced staff? When you're starting, your staff is not trained, so you would rather hire someone who is fast. But someone who is fast is not necessarily building the speed with you, so it's better to have your own staff than to constantly hire someone. So there's pros and cons. Your new staff may take longer to do something, then the procedure takes longer, so that costs you more. Results may not be ideal, so these workshops like today are ideal to give your staff plenty of time to practice. We load them with information on quality control, on critical thinking, so they have plenty of time to practice in the lab. So if you didn't bring your staff today, make sure that you send them next year, because this is the unique course where they spend a lot of hours really practicing. Sometimes you can have someone experienced come in and come to your office and train your staff. Or sometimes you can bring someone experienced and then they slowly, your staff trains. But if they have what I mean by it is, there's a different combination depending how you want to set up your office. I believe that cross-training is the best, because if one person doesn't show up, then what do you do if that person is the specialist in one skill? So cross-train everybody. Usually 2 to 3 assistants could help you in both strip and FE procedure. And I just happen to have one of our faculty downstairs moved to Florida. So come and ask me for her business card. She's looking for, if you want a training or want someone to come and help with your staff, she's willing to travel. So it's hard to find someone we can stand by. This just happened to be your lucky workshop today. And I know this time a person who is really good, and it's not